My name is Chandran and I'm the curator of TEDx Bangalore. The coronavirus has altered life as we know it across the planet. But as you can imagine, there are many Indias living in India. And the true impact of COVID-19 has been felt differently based on income levels, age, gender, caste, and a whole host of other qualifiers. In today's conversation, we're joined by Manoj Chandran, CEO of White Swan Foundation, to understand how 1 billion Indians are living with a fragile, critical mental healthcare ecosystem. This may be India's Achilles heel when it comes to COVID-19. So let's try to understand the multiple realities playing out in India, as well as what can we possibly do about it, both at a personal as well as a systemic level. Thanks so much, Manoj, for choosing to join us today. Could you tell us a little bit more about the White Swan Foundation? What's it all about?
Thank you, Sartaj, and thanks for having me here for the program. And so to begin with, White Swan Foundation is a not-for-profit organization that was created with the objective of delivering knowledge services for mental health and well-being. Now, in mental health care, what we saw when we started our life 7 years ago was that of all the problems and challenges that we have seen are evident in mental health care, the most fundamental was lack of access to knowledge, which was in many ways not empowering people to be able to make right decisions. When I say people, people would be across all profiles, people with the problem, their caregivers and the bystanders also. And when they were not empowered to make the right decisions, we said, how can we do that? How do we change the whole community there? Bring in about systemic change through knowledge so that they know that, okay, this is how I decide, how I make decision based on the profile that I carry around mental health care. So it's been now 7 years, and we have created by far the largest knowledge repository on mental health in India, and we do a lot of community outreach programs across communities. We've done that for a little bit for mental healthcare workers. We've done a lot with college students, and we currently focus a lot on school teachers and workplace mental health, actually. And the third part of our work is the mass communications programs, because as I pointed out, the most powerful element or stakeholder in mental health care is a bystander. They have a view on the subject, and their view is not necessarily always very positive and inclusive. So mass communication program of White Swan Foundation is to engage the common man, the community people into the fold of mental health care and get them to have a very different mindset and the empathy around people with mental health.
You are sensitizing the general public, yes, so that the stigma probably that they used to carry or they inherited probably from previous generations is eliminated. So with that worldview and with that position that you occupy in at least the Indian ecosystem, what is the state of mental health care in India today? We've been going through the pandemic.
Yes.
It's quite more complex now. So what would you say? Where do we stand?
Sure. Sartaj, we'll have to look at answering that question from different perspectives. To begin with, the fact remains that there is a huge prevalence of mental health issues. So the data that is always thrown at us is that 1 in 5 of us will have a mental health issue in our lifetime. Now that's a sizable number. If you look at in Indian context, it will be 300 million people. And so the problem is large. Then on the other hand, we have this whole narrative that the number of professionals in mental health care is abysmally low. And we need to ramp up our service infrastructure. Now that certainly is a requirement, but that probably is not the only solution. And we can't look at solving the problem of mental health care by only ramping up the service infrastructure and wait for that to happen. So that's the other perspective to it. The third, more powerful according to me, is the social context of mental health care, which is about how much are we allowing people with the problem to open up and seek help and create an environment for them which is inclusive, which is more empathic. Now, so are we therefore targeting to change the social narrative, the social construct around mental health care? Now, we have to look at all these three aspects to be able to come out with innovative solutions to the problems of mental health care.
Yeah, so allyship, we've seen it play out in the LGBTQ community,
yes,
in
yes,
PWDs and lots of other spaces. How is there for example, for viewers who don't know, and even in my case, How does allyship manifest in the mental health space? Is there an organization? Are there neighborhood communities? How does this play?
Great point, great point. So we often get into discussions on this subject, and this is so important because at the root of solving any problem in mental health care, Sartaj, I think it is about creating a world where everyone is a mental health ally. And the reason is because the moment I know I have a view on mental health and I have an attitude towards somebody who has a mental health issue, I am a stakeholder of mental health care. Now, am I carrying a positive or constructive view there? Am I a constructive stakeholder there or an ally there? There are two very broad, very basic ingredients required to be an ally. One is empathy. And I have seen this, that empathy does not get executed if you don't have the right knowledge.
Yeah.
Many a time, and most of the time when I am discussing, having sessions with or conversations with people, they will say that I have a colleague who has had a mental health issue, but I don't know how to approach the person. I don't know what to speak, how to communicate to the person. So I'm actually, by nature empathic, but I don't know how to demonstrate that empathy. I need to know, therefore, first is to permit yourself to say that I want to be a mental health ally. Now let me pick up the right knowledge to say that what does it mean? What is the objective of me being an ally or me deciding to do something for my colleague or my family member or my neighbor who may probably demonstrate some emotional distress? The moment I have begun to pick up the right knowledge, White Swan Foundation is just the right place because we have huge amount of content and information about being an ally, about knowing what is the objective of your action and what is that the person with the problem expecting of you as an ally.
Yeah.
This is what is required.
Yeah, allyship is sometimes uncomfortable because you're forced to occupy a position where you don't have all the answers, but you still need to be present for the other person.
Exactly.
It is a role of service leadership. I think this touches upon a big topic. We've broadly seen that a lot of mental health is this loss of sense of control. You feel that you are no longer in control of your own life, your own thoughts, your own situation, and that helplessness often emerges internally. Allyship is one way. Access to mental health care professionals is another way. What else can people do in this current context, especially because we never know when we could have another lockdown or a situation like that? Is there something people can do to regain that sense of control from maybe a self-care perspective?
Yes. So while we spoke until now about mental health from a curative perspective, which means that if there is a person who has a problem, what can be done that the person reaches out and seeks professional help? There is certainly a preventive element to mental health care, mental health issues. And this is extremely important, I would say, from an Indian perspective. And countries like India, which has huge shortfall of professionals and service infrastructure. Because if you really have to solve the problem, we have to probably also equally focus on not allowing the problem to become big, which is about getting people to understand the importance of preventive steps towards mental health care. So I think it is important for communities at every level, from a family unit to organizations and any other community unit that we could pick up, to begin to have this conversation around prioritizing mental well-being. Because then you are helping people who may be at risk. And then you are allowing people who could potentially be allied to say that I'm going to encourage people to focus on well-being. Leaders, I have been saying this, that leaders have an extremely important role to encourage mental well-being and getting people to prioritize, understand what needs to be done about mental well-being and mental wellness.
So Manoj, we spoke a lot about the impact that's being felt by the knowledge worker and a little bit about what the informal economy is also feeling. It's not possible to scale and ramp up our mental health care delivery infrastructure at least. So what's the role of technology in all of this? How can technology hopefully play a scale-up factor, right, in this?
So that's a great angle or perspective we must start to look at, particularly countries like India, which cannot only rely on ramping up the service infrastructure to solve the problems. We need technology to be able to help us innovate and come out with solutions which disrupt the way we are looking at addressing the problems. And I feel that in mental health care, particularly in India, we've just scratched the surface in terms of the possibilities and potential that it has. Of course, in the last 2-3 years, there's been a slight spurt in the kind of tele consulting or tele counseling that has been happening over the internet, and a lot of people have become more comfortable with that, and which is very good. And so access to professionals, at least from that perspective, has increased a little bit. So you don't have to necessarily now rely only on mental health professionals in your city or in your town. You can reach out. And then there are, of course, like from our perspective, we were talking about, we are a web portal essentially at the base of what we do, and all our content goes up on the portal. And we've seen the way people reach out and seek knowledge and seek to find what they need to do about mental health care. We have content in English and 5 Indian languages. We get 50% of our traffic for our English portal and 50% for our other 5 languages. Bangla and Hindi are largest kind of traffic places, actually platforms. So much so that 11% of our traffic comes from Bangladesh.
Wow.
And you can understand, and also the other data is about the geography. Of the top 10 cities that give us the traffic, only 4 of them are metros, 6 of them are non-metros. And so you can clearly see that need for knowledge is increasing so much on mental health care.
And the demand is irrespective of geography, they just need that access.
Yes.
Do you think the fact that technology is dehumanizing is a bit helpful in this context, because you have this shield around you, right? Because typically we've been growing up with the stigma of mental health. So do you think that plays a factor in our adoption?
So there has been. I mean, yes, people have told us that I feel more comfortable in using technology or technology-enabled services like teleconsulting or AI-based apps and all, so that I don't have to, like, it dehumanizes, and I don't have to interact physically with somebody who in front of me,
I think the other interesting part where I think some research also has coalesced around is screen addiction, right?
Yes.
Where we've seen that it is essentially the attention economy, and if people are reliant on technology, then maybe that they're not spending 15 plus hours a day looking at a screen. So there's a line.
Yes.
Once you cross that line, you're maybe more dependent than reliant, and the things shift. We've noticed companies like Google, Apple, Facebook suddenly incorporate screen addiction, time spent on screen, and wellness as some parts, of their product offering. Do you think technology leaders like Microsoft and Google and Apple, they play an outsized role because they ultimately are the platform owners, right? Do you think there is something interesting that might happen to engage top-down as well? Because it's not just top-down in government, right? Sometimes it's top-down in terms of technocratic institutions as well.
So, Sartaj, I think the problem of mental health care is so close to us that there is no outside role for anybody. Everybody has an inside role. At an individual level, in my family, I have to be extremely aware of it. I should know, okay, there are people like this and all. At organization level, at those leading organization level like Google and others, to say that what is that I should do every time I come out with an extremely nice, innovative solution, product out in the market.
Yeah.
So I think everybody has to make sure that all of us, every single person, and government, for instance, agencies, that mental health must be one of the priorities of all of us.
So you touched upon financing, right?
Yes.
How we've seen green bonds, we've seen lots of innovations happen in the social sector to try to tap certain types of funding. What does philanthropic or even other funding look like in the context of mental health care?
It's not enough.
It's never enough.
It's never enough. But in mental health care, given the size of the problem, given the innovation that we need to see, and then look at the kind of money available, it's not enough, certainly. So I think it is important for philanthropic funds to be able to say that whatever I have a focus on, there is an element of mental health to that. So I'm not looking for only mental health exclusive funds, but let's say some funds exist for education. Now, is there a part of that education fund which says that it is about emotional health of my children, of the students or who I am in the geography that I am serving?
Or SEL education or
SEL
spaces,
education and all. So SEL education is a classic one. I mean, am I really investing in that?
Yes.
Because we have a very strong teachers training program. We have a one-day training program. We've done that for 750 teachers because they are the first touch point in most cases where a problem in a child will come out and they will come to know about it. It all depends of the decision of the child or their parents in terms of how the teacher has reacted.
Yeah.
How the teacher has really looked at the problem and created an environment in the classroom for that child.
Yeah.
So, can I train teachers? Can I look at risk population in the classroom?
Yeah.
And what is it? So, a lot of data creation collection.
So we know that probably 3 to 4% of our GDP is just allocated on broad healthcare. Like that's the whole, that's our national allocation. I'm not really sure how much of that would be for mental healthcare as well. Do you think similar allocations exist probably in the philanthropic or social sector? Like people are thinking about healthcare, but probably 2 to 3% of those funds are for mental health care.
Exactly. No, I think one is, of course, there is a need for us to have exclusive mental health care funds for that, and really look at innovation, look at encouraging people to come out, be it social entrepreneurship area or even entrepreneurship area, and encourage them to come out with solutions. And we really need very innovative, nice solutions there. But I'm also saying that we want people who have funds for other sectors to be able to say that. I think environment, for instance.
Yeah.
What is the mental health angle to it?
Yeah.
Disaster, natural disaster, there are funds and all. What is the mental health angle to it?
So proximate partnerships within their funding interest,
focus,
but a grandfathering or at least involving mental healthcare into that.
Yes, yes.